Hi guys, so let's start with the question of the day. The question goes like a 45-year-old TB patient who is undergoing regular treatment comes to your OPD. His wife complains that he has been forgetting things like his dog name, friend's name. He also says that he can hear voices and see people. Which drug is the cause of his problem? A. Pyrazinamide, B. Isoniazid, C. Ethambutol, or D. Ethionamide. So this is a question from the topic TB. Now TB is a very important topic. Why? Because it comes in pharma, micro, path, PSM. So a topic which is coming in 4 subjects becomes a very important topic. Today we are only going to discuss the pharma part of TB. Let's start. So first we have to know the first line drugs of TB. First is rifampicin. What is the mechanism of action? It inhibits the DNA dependent RNA synthesis. And the resistance of this drug can be due to defect in RNA polymerase enzyme. It is metabolized by bile, so it has some enterohepatic circulation. What are the side effects? Hepatitis, CYP4 it is an inducer, enzyme inducer, and very important, you all know this red and orange discoloration of body fluids, that the urine will become orange in this case. So it is an inducer. All ATT drugs, first you have to remember, all ATT drugs are inducer except, I will tell you, isoniazid. From I, you can learn it is an inhibitor. So what is the mechanism of action also? Acid, you can learn it inhibits mycolic acid. That is, it inhibits the cell wall synthesis. As you all know that the TB mycobacterium cell wall, it is made up of mycolic acid. It is a prodrug. It is converted into its original form by CAT-G gene, catalase by catalase enzyme. So if this enzyme is defective or this gene is defective, the resistance will be there. So this question came in FMG this year only. The CAT gene resistance is responsible for which drug resistance? So it is isoniazid. And also it has maximum CSF penetration, that it can cross blood-brain barrier. So it can be given in meningitis. This is a very important and a good point which has not been asked and can be asked. So what are the side effects of isoniazid? So isoniazid, it inhibits vitamin B6. So vitamin B6 is important for many enzymes. It helps in production of GABA. GABA is an inhibitory neurotransmitter. So if GABA is not present, seizures can occur first of all. B6 is also responsible for ALS synthesis, which is responsible for your hemoglobin synthesis. So if B6 is not present, sideroblastic anemia can happen. So isoniazid, it is metabolized by acetylation. So you know about the mnemonic about SHIP drugs. So if there is problem in acetylation, there will be drug-induced lupus. SLE can be present. This is also an FMG question. It also presents with peripheral neuropathy and transient memory loss, that the patient will start to forget things. In isoniazid, it can also be written like INH. So I, it is an inhibitor of enzyme. N, it will affect the neurons. So that means peripheral neuropathy is present. And H means hepatotoxicity. But it is a reversible hepatotoxicity. Only dose-dependent hepatotoxicity is present. Third, peripheral neuropathy, and 4, transient memory loss. So this is all about isoniazid. I feel isoniazid is a very important drug in this. So for this question, he is forgetting things like dog's name, friend's name. So answer can be isoniazid, but we will look at other options also. Okay. So next is pyrazinamide. Pyrazinamide, it affects the fatty acid synthesis. It can also cross blood-brain barrier and it can be given in meningitis. An organ of excretion is kidney. So in renal failure, we need to stop pyrazinamide. Side effect, it is the most hepatotoxic and it can also present with hyperuricemia, can present with gout. Pyrazinamide. Ethambutol, थैम मतलब थम जाना है, वो ड्रग थम जाती है, मतलब स्टेबल ड्रग है, तो मतलब इट इज़ लीस्ट टॉक्सिक ड्रग. ऑल्सो इट ऑल्सो inhibits the arbanose acetyl transferase. So it also is responsible for inhibition of cell wall synthesis. What are the side effects? Ethambutol, you can also select ithambutol. So it is responsible for optic neuritis, that is red green color blindness, and it is also reversible. And hyperuricemia. So hyperuricemia, now you learn that two drugs are causing, pyrazinamide and ethambutol. One more drug which can cause eye redness, eye pain, that is uveitis, is rifabutin. Rifabutin, these are given in HIV patients because the HIV drugs, and they are also enzyme inducers inhibitor. To prevent interaction, we give rifabutin. And what are this the other side effect? Pseudo jaundice, that the patient will present with yellowing of skin, but there will be normal liver function. So if you want to take a take home message, you need to learn this slide. Most hepatotoxic drug, pyrazinamide, then H, then R. Hyperuricemia, it is caused by pyrazinamide, ethambutol. All are cidal drugs. All will kill the microbacterium TB except ethambutol. So you can learn by mnemonic RIPS. From R, rifampicin, isoniazid, pyrazinamide. You know this. All are intra and extracellular. All drugs will kill both intra and extracellular bacilli except pyrazinamide. In this you can learn in. अंदर तो वो इंट्रा वाले को ही इट विल किल. एंड स्ट्रेप्टोमाइसिन एक्स्ट्रा बाहर, इट विल किल द आउटसाइड bacilli. This is an INI-CT PYQ, came in November INI set 2023. Which drugs cause hypothyroidism? Ethionamide. Third, you can learn like it will affect the thyroid and pass. Which two drugs will cause some mental changes? Cycloserine and isoniazid. Isoniazid, it is associated with transient memory loss, and you can learn like cycloserine as cycle की तरह जैसे दिमाग will it will circle around. So some mental changes are present. Now I just wrote this point because I used to forget this a lot. What is the difference between ethambutol and ethionamide? I know this was a very confusing topic for me. Ethambutol, it is not hepatotoxic, but ethionamide, it is hepatotoxic. Ethambutol, it is cleared by kidney. All ATT drugs are enzyme inducers except isoniazid. Isoniazid is an inhibitor. So this is all about TB, and there are many new drugs like bedaquiline. A side effect is QT prolongation. I will not discuss this, but you should know these basic points about. And this slide is an take home message for you. You can take a screenshot and keep revising all the stuff. So for this question, the answer will be isoniazid only. Thank you guys. See you tomorrow with another question.